Gentlemen, what if I told you there are three specific pressure points on your body that, when pressed for just 5 seconds each, can restore the kind of firm, reliable morning erections you haven't experienced in years? No pills, no pumps, no expensive treatments. I'm Dr. Lila Romano, a urologist with over 10 years of experience helping men reclaim their sexual vitality. And today, I'm going to reveal a simple 5-second exercise that a British medical study proved restored normal erectile function in 40% of men over 50, with another 35% showing significant improvement. That's a 75% success rate, using nothing but your own hands and a few minutes of your time each day. Stay with me until the end, because I'll show you exactly where these 3 points are located, how to stimulate them correctly, and why this technique works when so many other approaches fail. Before we dive into the solution, I need you to understand what's really happening inside your body after 50. Because once you see the true cause of weakening erections, you'll realize why this simple pressure point technique is so remarkably effective. Here's the truth that most doctors won't take the time to explain. An erection isn't just about desire or blood flow. It's about a precisely coordinated symphony between your nervous system, your blood vessels, and a group of muscles you've probably never even thought about, your pelvic floor muscles. These hidden muscles act like a natural locking mechanism. When they're strong and responsive, they trap blood inside the erectile tissue, keeping you firm and hard for as long as you need. But when these muscles weaken with age, lack of use, or chronic tension, that's when everything starts to fall apart. You might still feel desire. Your mind might be completely ready, but your body just can't deliver the way it used to. Morning erections become weaker, less frequent, or disappear entirely. Firmness fades too quickly during intimacy. And that feeling of confident, effortless hardness, it becomes a distant memory. I see this pattern in my practice every single day. Men in their 50s, 60s, and 70s who feel betrayed by their own bodies. And here's what frustrates me the most. Most of them have never been told that these muscles can be retrained, strengthened, and brought back to life with a simple, targeted exercise that takes less time than brushing your teeth. Now, I know what you might be thinking. Another exercise routine? Another promise that sounds too good to be true? I understand that skepticism completely. That's why I'm not asking you to just trust me. I'm asking you to trust the science. In 2005, the British Journal of General Practice published a landmark study that changed how we think about treating erectile dysfunction. Researchers followed 55 men with a median age of 59 years, men just like you, who were struggling with weak or unreliable erections. These men weren't given pills. They weren't given injections or devices. They were simply taught how to properly strengthen their pelvic floor muscles through targeted exercises. The results were extraordinary. After just 6 months, 40% of these men regained completely normal erectile function. Not slight improvement, normal function. Another 35.5% showed significant improvement in firmness and reliability. That's a combined 75% success rate. But here's what really caught my attention as a urologist. The researchers concluded that pelvic floor training should be considered the first-line approach for men seeking long-term resolution of erectile dysfunction, not a backup plan, not something to try if medication fails. The first approach. And yet, decades later, most men have never even heard of this technique. That needs to change. And it's going to change right now, starting with you. So let me reveal exactly what this exercise is and why I'm framing it as 3 distinct pressure points. Because when you understand the anatomy, you'll realize you're not just doing some generic squeeze. You're strategically activating 3 critical areas that directly control erectile strength. Pressure point number 1, the base groove. The first point sits right at the base of your penis, where the shaft meets your pubic area. If you run your fingers along the underside toward your body, you'll feel a natural groove or slight indentation. This isn't just skin. Beneath this spot lies a dense network of nerve endings and blood vessel junctions that feed directly into your erectile chambers. Think of this as a control hub where circulation and nerve signals converge. When you press and massage this area with firm, circular motions, you're doing 2 critical things. First, you're lighting up nerve pathways that connect to your spinal cord's erection center. These signals tell your brain and body we're activating the erectile system. Get ready. Second, you're encouraging blood vessels to relax and open, allowing more nutrient-rich blood to flow into the tissues that need it most. This point primes the entire mechanism for what comes next. Pressure point number 2, the perineum. Now, the second point is one that most men completely overlook, but it's absolutely critical. This is your perineum, that soft, slightly muscular area located between your scrotum and your anus. I know it might feel awkward to think about, but stay with me because this spot is a game changer. Directly beneath the surface of your perineum lies the bulbospongiosus muscle. This is one of the main muscles in your pelvic floor, and its job is to act like a natural clamp during an erection. When this muscle contracts powerfully, it traps blood inside your penis, preventing it from draining away too quickly. It's what keeps you hard. When this muscle is weak or unresponsive, blood leaks out, firmness fades, and you lose your erection before you're ready. By applying firm, steady pressure to the perineum and massaging in slow circles, you're directly stimulating this muscle. You're teaching it to wake up, engage, and respond. Over time, this strengthens the muscle's tone and improves its reflexive contraction during arousal. Many of my patients describe this as rediscovering a lock they didn't even know they had. Suddenly, erections don't just arrive, they stay. Pressure point number 3, the coronal ridge. The third and final point is located just beneath the head of your penis, along the ridge where the glans meets the shaft. This area is called the corona, and it's packed with an incredibly dense concentration of sensory nerve endings. These nerves are your body's main messengers for sexual arousal, transmitting signals to your brain and spinal cord that trigger the entire erectile response. When you gently stimulate this area with a hold and release technique, applying light pressure for 5 seconds, then releasing, you're essentially recalibrating your nervous system. You're reminding those nerve pathways how to respond quickly and efficiently to arousal signals. Over time, this heightened sensitivity translates into faster, stronger, more spontaneous erections. It's like tuning up the electrical wiring of your sexual response system. Now here's the beautiful part. When you combine all 3 of these pressure points into one simple daily routine, you're addressing every major component of erectile function simultaneously. You're improving circulation, strengthening muscle tone, and enhancing nerve responsiveness. It's a complete system reset, and it takes less than 5 minutes a day. Now let me explain exactly why this works on a biological level. Because once you understand the mechanisms, you'll realize this isn't some gimmick. It's basic human physiology being put to work in your favor. Let's start with the blood flow component. Erections are fundamentally a hydraulic event. Think of your penis like a sponge made of specialized erectile tissue called the corpora cavernosa. When you become aroused, these tissues need to rapidly fill with blood and then trap that blood inside to create rigidity. The problem after 50 is that the small arteries feeding these tissues can become less flexible due to age, inflammation, or reduced nitric oxide production. Blood flow slows down. Filling takes longer. Firmness becomes harder to achieve and maintain. When you massage and stimulate pressure point 1 at the base, you're encouraging those small arteries to dilate and relax. The mechanical pressure combined with the nerve activation triggers a localized release of nitric oxide, the same molecule that medications like Viagra work to enhance. But you're doing it naturally through your own body's response to targeted touch. Over weeks of consistent practice, this repeated stimulation actually improves the baseline flexibility and responsiveness of these blood vessels. They stay healthier, more open, and more ready to deliver the surge of blood you need. Now let's talk about the muscle strength factor. This is where pressure point 2, the perineum, becomes absolutely critical. The bulbospongiosus muscle and the other pelvic floor muscles don't just support your bladder and bowel function. They are directly responsible for trapping blood in your penis during an erection. These muscles compress the veins that would normally drain blood away. When they contract strongly, blood stays locked inside and you stay hard. But here's the problem. Most men never consciously engage these muscles. They weaken from disuse, just like any other muscle in your body would. A weak pelvic floor means poor blood retention, which means erections that start strong but fade quickly. By applying direct pressure and massage to the perineum, you're not only strengthening these muscles through reflexive activation, you're also improving your conscious awareness of them. You're building what physical therapists call proprioception, the ability to feel and control these muscles on command. Over time, this translates into firmer, longer-lasting erections because your body remembers how to lock the blood in place. Finally, let's address the nerve sensitivity component, which is where pressure point 3 comes in. Your erectile response is controlled by a complex network of nerves that run from your spinal cord down through your pelvis and into your penis. These nerves carry two-way signals. Arousal signals travel from your brain down to tell your penis to fill with blood. Sensory signals travel back up from your penis to tell your brain, "This feels good, keep going." As we age, these nerve pathways can become less efficient. Signals slow down. Sensitivity decreases. Arousal takes longer. By stimulating the highly sensitive corona area with rhythmic pressure, you're essentially exercising these nerve pathways. You're keeping them active, responsive, and finely tuned. Think of it like keeping a road well-traveled so it doesn't become overgrown. The more you stimulate these pathways correctly, the faster and more reliably they respond when you need them to. The combination of all three mechanisms, improved blood flow, stronger muscle tone, and enhanced nerve responsiveness, creates what I call a virtuous cycle of erectile health. Each component supports the others. Better blood flow makes muscles work more efficiently. Stronger muscles improve the quality of nerve signals. Better nerve function enhances blood flow. It all works together, and that's why this simple technique can produce results that feel almost miraculous when you've been struggling for years. All right, gentlemen. Now it's time for you to learn exactly how to do this. I'm going to walk you through the complete protocol step by step, so you can start tonight and begin seeing results within just a few weeks. Here's how this works in practice. Set aside 5 to 7 minutes when you have complete privacy and won't be interrupted. Many men find that doing this in the morning after waking or in the evening before bed works best. Consistency matters more than the specific time of day, so choose whatever fits naturally into your schedule and stick with it. Let's begin this with the base groove. Start by sitting comfortably or lying on your back with your knees slightly bent. Using your thumb and index finger, locate that natural groove at the very base of your penis on the underside where it meets your pubic area. You should feel a slight indentation. Apply moderate pressure with your thumb, firm enough that you feel the underlying tissue, but never to the point of pain. Begin making small, slow circular motions about the size of a quarter. Move clockwise for 30 seconds, then counterclockwise for 30 seconds. As you work, you might notice a pleasant warmth spreading through the area, or even a subtle tingling. That's increased blood flow responding to your touch. For the final 30 seconds, switch to gentle back and forth. Strokes along the groove. This takes about 90 seconds total and prepares your system beautifully. Now shift your attention to the perineum. You can do this sitting or lying down, whichever allows easier access. Position your index and middle fingers on the center of that soft area between your scrotum and anus. Press inward with firm, steady pressure, not hard enough to cause discomfort, but enough that you feel you're reaching the muscle beneath the skin. Hold this pressure for 5 seconds, then release completely for 3 seconds. Repeat this hold and release pattern 10 times. After those 10 reps, switch to slow circular massage in that same spot for about 60 seconds. You're looking to create a deep, warming sensation as the muscle begins to engage and relax. Many men report feeling a gentle pulsing or subtle tightening in the pelvic region during this step. That's your body waking up muscles it hasn't consciously used in years. This entire perineum work takes about 2 to 3 minutes. For an advanced variation, once you're comfortable with the basic technique, you can combine this pressure with conscious muscle contraction. As you press, deliberately tighten your pelvic floor muscles, the same ones you'd use to stop urinating midstream. Hold both the external pressure and the internal squeeze for 5 seconds, then release everything. This double activation creates even more powerful strengthening effects. For the final area, gently take hold of your penis with your thumb on top and your index finger underneath, positioning them along the ridge where the head meets the shaft. This area should feel distinctly more textured than the smooth shaft. Apply light, even pressure with both fingers, creating a gentle pinch around the entire circumference of the corona. Hold this pressure for 5 seconds, then release completely. Repeat this hold and release sequence 10 times. After the 10 reps, switch to very light circular motions around the entire ridge for about 30 to 45 seconds. The key here is gentleness. This area is extremely sensitive, and overstimulation can actually desensitize rather than enhance. You want just enough touch to wake up those nerve endings and remind them how to respond. This final step takes just 1 to 2 minutes, and with that, you've completed the full routine. Do this complete 3-point routine once daily, every single day, for at least 4 weeks before evaluating your results. Consistency is absolutely critical. Skipping days or doing it irregularly won't give your body the repeated stimulus it needs to create lasting change. Keep your breathing slow and steady throughout the entire routine. Don't hold your breath. Proper oxygenation helps your tissues respond and recover better. If you feel any sharp pain, stop immediately. You should only feel pressure, warmth, or mild muscle fatigue, never pain. If something hurts, you're pressing too hard or in the wrong location. For maximum benefit, pair this routine with basic Kegel exercises. 3 times a day, wherever you are, contract your pelvic floor muscles for 5 seconds, then release for 5 seconds. Do 10 repetitions per set. This adds extra strengthening on top of the pressure point work. Now, before you start, there are a few critical warnings and common mistakes I need you to avoid. These will ensure you get results safely and effectively. Mistake number 1. Pressing too hard too soon. The biggest error I see is men applying excessive pressure in the first week because they want faster results. Your pelvic tissues need time to adapt. Start with moderate pressure and gradually increase over 2 to 3 weeks as your body adjusts. Pressing too aggressively can cause soreness, bruising, or even temporary numbness. Be patient. Gentle, consistent pressure wins over forceful, irregular attempts every single time. Mistake number 2, inconsistent practice. Doing this routine sporadically, 3 days on, 4 days off, then twice in 1 day to catch up, will not work. Your neuromuscular system needs regular, repeated stimulus to create lasting change. Think of it like learning an instrument. Practicing once a week won't make you proficient. Daily practice, even if brief, creates real skill. The same applies here. Mistake number 3, ignoring overall health. This technique is powerful, but it's not magic. If you're carrying significant excess weight, smoking, drinking heavily, or managing uncontrolled diabetes or hypertension, those factors will limit your results. This exercise works best when combined with basic health fundamentals, staying hydrated, eating a diet rich in vegetables and healthy fats, moving your body regularly, and getting 7 to 8 hours of quality sleep. Address the lifestyle factors while doing the exercises, and your results will multiply. If you experience sudden, complete loss of erectile function, painful erections, significant curvature, or blood in your semen, stop the exercises and consult a urologist immediately. These can be signs of underlying conditions like Peyronie's disease or vascular problems that need medical evaluation. If you have a history of pelvic surgery, prostate issues, or chronic pelvic pain, talk to your doctor before starting this routine. In most cases, it will still be safe and beneficial, but you may need modifications based on your specific situation. Let's talk about what you can realistically expect and when you'll start noticing changes. I want to set honest expectations so you stay motivated and don't give up too early. Week 1 to 2, awareness and sensation. In the first 1 to 2 weeks, you likely won't see dramatic erectile changes yet. What you will notice is increased awareness and subtle sensations in your pelvic region. You might feel a gentle warmth, occasional tingling, or even mild muscle soreness in the perineum area, similar to what you'd feel after starting a new workout. This is completely normal. Your body is waking up muscles and nerve pathways that have been dormant. Some men also report feeling more present or connected to their pelvic area during this phase. Week 3 to 6, early improvements. This is when most men start seeing real, tangible results. Morning erections often return first or become noticeably firmer if they were already present but weak. You might wake up with that full, rigid feeling you haven't experienced in months or even years. Spontaneous arousal during the day may increase. When intimacy happens, you'll likely notice it takes less mental effort to achieve firmness, and the erection feels more stable, less likely to fade if there's a brief distraction or position change. Week 8 to 12, significant transformation. By the 2 to 3 month mark, the improvements typically become undeniable. This is the time frame where the British study showed 40% of men regaining normal function and another 35% showing significant improvement. Erections not only arrive more easily, they last longer with better rigidity. Many men report that the quality of their orgasms improves as well, feeling more intense and satisfying due to the stronger pelvic floor contractions. Confidence returns. Anxiety around performance starts to fade. Intimacy becomes something you look forward to rather than worry about. 6 months and beyond, maintenance and mastery. Once you hit the 6-month mark with consistent daily practice, these improvements tend to stabilize and become your new normal. At this point, some men choose to reduce frequency to 4 or 5 times per week for maintenance rather than daily. Others continue the full routine because it's become a valued part of their self-care. The key is never stopping completely. These muscles need ongoing engagement to stay strong, just like any other muscle group in your body. Gentlemen, I want you to really hear what I'm about to say. You don't have to accept weak erections, disappearing morning wood, or declining sexual confidence as an inevitable part of aging. You have more control over this than you've been led to believe. The 3 pressure points I've just revealed, the base groove, the perineum, and the coronal ridge, are not secrets locked away in some medical textbook. They're parts of your own body, waiting to be activated and strengthened through simple, consistent practice. A British medical study with men in their 50s and 60s proved that 75% saw meaningful improvement using nothing but targeted pelvic floor training. No pills, no procedures, no side effects, just a few minutes of intentional daily effort. And the beautiful part? The longer you do this, the better it gets. This isn't a temporary fix that wears off when you stop. This is genuine, lasting strengthening of the very muscles and systems that control your erectile function. So here's my challenge to you. Commit to this 3-point routine for the next 30 days. Just 30 days. 5 to 7 minutes every single morning or evening. Track your results. Notice how your body responds. Pay attention to your morning erections, your firmness during intimacy, and most importantly, how you feel about yourself and your capability as a man. If this information has been valuable to you, I'd love for you to subscribe to this channel. I'm here to provide you with honest, science-backed strategies for reclaiming your vitality at every age. No hype, no false promises, just real medical knowledge presented in a way that empowers you to take action. And if you know another man over 50 who's struggling with these issues, a friend, a brother, a colleague, share this video with him. These conversations matter. Men's sexual health is not something to be embarrassed about or suffered in silence. It's a fundamental part of overall health and quality of life. The more we talk about it openly, the more men we can help. Leave a comment below and let me know, are you going to try the 3-point routine? What results are you hoping for? I read every comment, and your feedback helps me create more videos that serve you better. This is Dr. Lila Romano, and I'll see you in the next video.